Coachella 2022. Coachella 2022. Somebody a go look for your coffin when I walk on the beach and say, huh, you notice that on her coffin bigger than one? Ugh, she's so unattractive. Ugh. Alright. Today we are what? Beauty standards have lost the plot. Me we should say by Bossy Siwa Bossy Swa. Sound African. But me we should say. Half
I came to
what?
Dr.
Wait. Start over.
Have you guys heard of calf docs? Because as a former ballet dancer with muscular calves, I tried it last year and got results like this. So when I was in Korea this time, I came to Dr.
Half
Evers to
docs.
get around
Wait.
calves. I tried it last year and got results. Have you guys heard of calf docs?
Wait. Calf what? Calf talks. Oh. Okay. Like Botox in your calves. Why you don't want that?
As a former ballet dancer with muscular calves, I tried it last year and got results like this. So when I was in Korea this time, I came to Dr. Evers to get a round 2 of it. When the doctor came in, he carefully assessed my calf muscles to customize the injection points, and the procedure
Wait, so
itself was
if you have muscular calves, isn't that a good thing? Oh, like what should and then if you put the Botox in your calf, it not gonna be like it not gonna look bigger. So like what you try? You try have muscular calves or you don't want muscular calves? Interesting.
quick and the pain was tolerable. It's just a few small pinches and I was done in like less than a minute. This is my calf right after, and they gave me bruise cream, which I did end up using the next day because I had some light bruising. But yeah, that was my experience getting calf docs. Bye.
Oh, so okay, me think me get it now. So she wanted to be like round, she don't want it to look muscular. That's weird. Muscular calves look cool.
Word on the street is that humans are now getting botulinum toxin injections in their calf muscles. Yes, calf muscles to temporarily weaken their lower leg plantar flexors. Doesn't sound so cute now, does it?
Ouch.
That's because it isn't. I'm kidding. That's why they call it Barbie legs.
What the hell?
So this lovely lady is here today to reduce the size of her calf.
That's
and
crazy.
It seems to be a new trend with Botox. Here you can see that calf muscle is quite a large muscle. And relax. We're going to start with probably 50 units.
No, dog. Like, that never needed, man. That never needed at all. I feel like if the muscle, the problem if you lose weight, you go lose weight. And then them reduce them calf and them foot still big. If your foot big, your foot just big. It's not the calf, but them are gonna realize sooner or later.
Per side, we're going to have her come back in 4 weeks. If she needs more, we are going to give her some more.
Fun fact, especially if you're interested in doing this procedure, your calves are not just existing for funsies. Class is in session. The calves are very important. They help you walk, balance, climb stairs, stand, and they even help you push off the ground. And most importantly, they help you move blood back towards your heart. Some of y'all may not have known that.
Oh, never know that at all. Never got science class.
For that. It's so crazy to me that this is the desired look based off a 3D or CGI animated character. No hate, no shade to Bobby. She has had.
Wait up. As a husband that grew up with a Barbie obsessed
No hate, no shade.
Okay. I just wanna edit this. Okay. I see now. I'm reading, but we're gonna try to read it before them take it off our skin. As a husband that grew up with a Barbie obsessed sister, I know it's a doll. That's a lot later got cartoons. I apologize for this oversight. Bro, it's okay. Oh my god, who watch your video, they make you feel like so that's something we need to apologize for. I guess I don't want to be accurate on the information and this and don't spread misinformation, but damn, it's okay. She's a 3D. Oh my god. Come on.
No hate, no shade to Bobby. She has had every career known to mankind. Doctor, astronaut, president, veterinarian, fashion designer. That woman has a resume longer than my own patience. But Barbie legs, as you guys can see, are not built like real legs. And the ideal being sold is a straighter leg line from knee to ankle, less visible calf bulge from the side or even the back, slimmer looking legs and heels.
It's not that deep, but as you can see it that deep for some people. Like, that's crazy. Oh my god, what a world.
skirts, dresses, shorts, or even boots. A less athletic or muscular lower body. A
My
more
biggest flex. Oh my god. Okay, okay. My biggest flex. That your biggest flex. Like who cares? Like some of them things I just like get out on, dog.
delicate, doll-like silhouette.
Sahalit?
Y'all know I had to replay that. This is why the name Barbie legs works so well as marketing. Barbie's legs are elongated, they're smooth, they're simplified, and they're basically designed by someone who has never had to carry those.
This picture is my biggest flex. Whenever I'm feeling down about myself, I remember
Yo,
this
come up on
picture,
the screen, bro.
Coachella 2022, and
Coachella 2022. Coachella 2022.
I instantly feel better. I'm like Barbie legs, like Barbie ankle, Barbie little foot. Like, take notes, Margot Robbie. I was the blueprint. I was the blueprint.
Quick disclaimer before I keep yapping, I am not in the medical field. I am just somebody who finds cosmetic procedures weirdly fascinating, especially when beauty trends start treating full functioning body parts
Yo,
like their design
That's
flaws.
crazy.
This video
You
is
cough,
comment
you know, dog. You cough. You cough. You cough.
and education, not medical advice. If you're considering something like this, please talk to a qualified medical professional. No fake degrees over here. If you know, you know what's happening in the streets right now. No hate, no shade to you, man, but just show the people the degrees.
Hi everyone, we're going to be doing a calf Botox today. Her calves are a little bit asymmetric. The foot that presses on the pedal of the gas pedal has grown larger than the other side.
Yeah, and what?
And she'd like them more evened out for the summertime. So we're going to be relaxing the
You
muscle.
think somebody are gonna look at your cough when you walk on the beach and say, huh, you notice that when I cough then bigger than one? Ugh, she's so unattractive. Ugh. Oh my god.
A little bit to reduce the size. I have some Botox drawn up and we're going to be injecting in just a second. All right, go on your tippy toes one more time and then relax again. Here we go. 1, 2, 3. Ouch. You okay?
Mm-hmm.
Oh my god.
1, 2, 3. That's it. Pretty simple procedure.
Yo.
It's probably gonna kick in about 10 days, but as far as the atrophy of the muscle to reduce the size, it usually takes maybe a month or two to actually see a difference. And I recommend doing
Atrophy, that means you lose muscle. Yeah, so you on purpose to lose the muscle in your calf. I mean, sure, your body build a muscle if you're purpose because it says you use the calf a lot. But no, you want atrophy on purpose. You look good. Shit.
a touch-up based on how many units you use about every 3 to 6 months.
Now, the procedure, from what I have seen, is targeting people who may already be thin, but feel as though their calves make them look stocky, make them look masculine, make them look maybe shorter, or even less feminine, which is already sad because now apparently having the lower leg strength to survive a
Like,
staircase
they never see the, oh, never mind.
is masculine. As somebody that is not pro cosmetic surgery, I think it's fair to bring out the positives in a procedure, just so you guys aren't scared either.
Okay,
so from
let me
a
hear
purely
the
cosmetic standpoint,
positives.
Calf Talks, which is the Barbie legs, does have reasons people are drawn towards it, or at least reasons I think they're drawn towards it. First being, it is non-surgical. If you compare it with calf liposuction, nerve procedures, or surgical calf reduction, box-based calf contouring, for lack of a better term, does not require cutting into the legs or removing muscle or going through this major complex operation. And I can honestly understand why that sounds more appealing. A more invasive calf reduction procedure can involve greater complexity, it can require more money, possible hospital stay, recover time, and more serious complications.
Yeah, but what's the catch though? Because if it not that invasive and in a dark bad and someone come on, what's coming?
Second thing I noticed is that it can create a real but modest slimming effect when the calf size is mainly muscle. Third is it can help with calf asymmetry or shape, not just the size. So some people may have one calf that bulges more than the other, or a very prominent inner or outer calf head. Fourth, the temporary nature can be seen as a positive. Unlike surgical removal or even nerve cutting, Botox wears off. So if someone hates the results, the muscle usually recovers over time, aka bounces back. With that being said, temporary also means
I never know that. Damn. I mean that going kind of harsh. But okay. Oh. So you tell me, so the people that put Botox in them forehead, like that'll go wear off, but all them forehead go look now. Them skin are go stretch out even more. I don't know, no, don't take no advice from me.
means med spa's favorite word, maintenance. Maintenance means repeat appointments. It means repeat cost, money, and repeat exposure to possible risk. So basically, it's not just getting Barbie legs. You're essentially subscribing to calf management or calf maintenance, as the med spa people would say.
That's everything with Botox, though. You always have to come back.
Shades of med spas, it's just a lot of y'all seem to be a little sketch, but whatever.
When we're placing Botox in the calves for reduction, we are just simply weakening that muscle so it shrinks down. We are not paralyzing the muscle completely.
Hey, like watch her forehead. Like when you think she having Botox in her forehead. Yeah, she kinda look like she have Botox in her forehead. Yeah, but I don't know still. But like watch when she move her eyebrows, but she have her makeup too. Alright, into that deep. Don't know into that deep. Never mind.
Which would prevent you from walking. Similar to putting Botox in your masseters for jawline slimming or in your trapezius for that shoulder slimming.
Oh yeah, definitely. She have all of the Botox. Forehead, jaw. What she said, like a monster slimming. She have all of them. Never mind.
Still able to chew, you're still able to shrug your shoulders, but you're simply just getting a nice slimming result. But if this is not injected into the right muscles, using the right technique, using the right dosage, it can lead to an undesirable result or cause side effects such as a limitation.
Yeah, but that's every Botox. That's all of them, right? Oh, if you do wrong, you're gonna look like shit. I guess that's the idea.
Mobility. So definitely go to someone who has done a high number of this.
Now I'm going to talk about the limits people don't always hear about, and I thought they were really interesting, so why not share it? Calf Talks Barbie legs do not shrink bones, y'all. So it's not magic. It will bounce back. It does not remove fat. It does not fix swelling. It does not treat varicose veins. It does not magically make every leg look like
it atrophy muscle. That do one say.
Legs. This matters because some people have larger calves because of my
Genetics.
number one favorite that a lot of people don't mention.
Genetics.
Fat distribution, fluid retention, lymphedema, lipedema,
Okay.
venous disease.
So now you use too much words now. Like you could have stopped at like fluid retention. I don't really know what it mean, but you know, can use context clues. But now you're gonna lipo this and like what? No.
Bone structure, muscle from walking, from stairs, from sports, or even training. So if the calf size is not mainly muscular, the results can be underwhelming. This is where some clinics start acting like every leg has a slim button hidden behind the knee. Bodies are not Photoshop. The procedure only makes sense for a very specific anatomy. The bigger issue I see with Calf Talks is that it turns
So that's like me that said just lose the weight because more time I leave with muscle, more oil fat.
a functional muscle into a beauty problem. I won't be saying the names of these two muscles. You guys are seeing them over here because they'll make fun of my accent
Castrocem. Okay, never mind.
at times, but these muscles do help with walking, balancing, posture, ankle movement, jumping,
Hey, it's a
running.
fuck that. Hey, that's cool, man. I teeth that. But you might go and charge though, anyway. Charge that. That catch me more a while to me know.
And pushing your body forward. So when people say it just slims the calf, I'm like, okay,
Lies.
but how? because the method is not magic, it's not fairy dust, it's not a leg contouring mist. It is literally weakening part of a muscle group that your body actually uses. And I was reading up on a study on gait and posture, gait referring to a person's pattern or style of walking, and it said that after botulinum toxin injection into this muscle,
And then them think they can like them problem can go back up. Cause say you walk away, now your back set away, and now it just mess up all your body.
volume decreased as expected. The thing is, researchers also found very subtle impairments in dynamic balance control during walking, even when basic gait measures like speed and step length looked mostly unchanged. And I found that important to mention because the average person may think, well, I can still walk, so I should be fine. And you'll find that in a lot of videos. If you go on TikTok or YouTube, a lot of people will say, I can walk, it's fine. But walking is not only about moving forward. It is also about the micro adjustments that we do that you may not pay attention to because, you know, you're not messing with your calves. Catching yourself when you trip, your calves help with that. Walking on uneven ground, wearing heels, climbing stairs, stepping off a curb, maybe even hitting a curb. I'm kidding. Balancing when your body weight shifts. That helps as well. Basically, all the things your body does automatically. So as you can imagine, if a calf is weakened, those tiny corrections that they do can change. In one calf contouring study, and I'll have these linked in the description, there were no major complications, but patients did report aching pain, weakness while standing or walking, resting calf soreness, and one calf spasm. And those symptoms did resolve within a month in that study, but they still show the obvious reality. When you inject a movement muscle to make it weaker, some people feel weaker.
Botox can be used to minimize muscle contraction, but it can also be used to decrease the width and strength of the muscle. What you're seeing here is Botox being used in the calf of the muscle. So similar to how we do Botox in the masseters or in the trapezius, this can help slim the calf muscle if done with enough units. So this is commonly done in people that feel like their calf is too wide. However, it is important to note that it can cause a little bit of weakness. So for those who are athletes, that's not something I would recommend.
As you guys know, this is Miss Cha Won-young. She is like this perfect Barbie doll princess, super pretty K-pop idol. She's obviously known for her super pretty face, but she's actually also known for her super long skinny legs. And you guys, K-pop idols dance like 12 hours a day, and that is a workout. And when you're constantly working out your legs like that, your calves will get bigger because it's just going to build more muscle. But as you can see, her legs are super skinny. They're just like the definition of perfect Barbie legs. Korean celebrities, K-pop idols are always just ahead of the game because Korea is just known for like beauty treatments. And they have been doing calf slimming treatments for over 10 years. This is our real patient. She's also a dancer, but she just wanted her calves to look slimmer and less muscular like this. So we did treat her with Botox. As you can see, her legs look less muscular and they are a lot slimmer. Calf Botox is a really quick and easy treatment. It takes about 2 to 3 months for the full results to show, and the results can last about 8 to 12 months. Calf Botox will not get in the way of your daily activities. You can work out, you can dance, you can
You
walk.
don't know that. Yeah, doctor? Yeah, doctor? Nice to you.
You can run. You can basically do everything that you were already doing, but your legs will just look skinnier. Who doesn't love that?
Before we continue, I just want to take a moment to shout out my Anti-Delulu Den members. Y'all already know who you are. Thank you guys for the support. Hope you guys are enjoying the early access. I'm loving the comments as well as enjoying the badges. I appreciate each and every one of you guys. And if you guys watching this video would like to join the Tab Den, let's get more serious. As I've mentioned, this mess. The vascular conversation is where this trend gets more serious. As I've mentioned a little in my fun facts, the calf muscles are often called part of the body's muscle pump system. Basically, when you walk, your calf muscles, they squeeze veins in the lower leg and help move blood upward towards the heart. So you can look at your calves right now and say thank you if they're not troubling you. Another thing to note is that calf muscle pump dysfunction is relevant in chronic venous disease, and that improving calf pump function through exercise may be clinically important in managing managing symptomatic venous disease. Now, to be clear, that does not mean that Calf Talks automatically causes varicose veins or even blood clots or chronic venous insufficiency. That would be too broad. That would be bold of me to say, especially if it hasn't been proven. But it does mean that there is a reasonable medical concern. If you are intentionally weakening a muscle group involved in venous return, especially in someone who already has poor circulation,
That
varicose
look hot.
disease,
Oh my god. Yeah, that needle that look like it broke a while ago. Ah, wait, go back a little bit more and see that again. Jesus Christ. Look.
concern. If you are intentionally weakening a muscle group involved in
Sita?
venous return, especially in someone who already has poor circulation, varicose disease, swelling, a
Oh.
history of blood clots, long
No. Alright, probably never look like it that, bro. But at first glance, it look like damn. Empty, dog. You don't need to do this. You do not need to do this. You do not need to do this.
sitting or standing habits or low activity, you are messing with a system that has a job. Your calves help circulation, and weakening them for aesthetics could be a very bad idea for the wrong patient. There are also normal injection related risks such as bruising, bleeding, swelling, inflammation,
God.
tenderness, pain,
Remember
or
things that this would be a thing, dog. Like calves, your calves, them too. This is a whole world I'm gonna know as a man, definitely. Yeah, this is insane. Calves, them too big, just lose some weight. Maybe I said just lose some weight, but you know what I mean.
accidentally affecting nearby structures. The official Botox cosmetic labeling notes that localized pain, infection, inflammation, tenderness, swelling, redness, bleeding, and
Like,
bruising
if you use them a lot, your body will build the muscle so you can use them better. Then you go in and say, oh no, them are too big. You got actually free the muscle. Your body say, wait, oh God, we never fix them they were there. Like, mess up your thing, mess up your system.
can be associated with injection procedures. And that brings me to another thing that gets softened by beauty branding. Botox is still a drug. It is a prescription drug. The official Botox cosmetic label carries a warning that toxin
Wait, so that means you can get addicted to it? I'm gonna know.
effects can spread beyond the injected area and cause symptoms such as generalized muscle weakness, double vision, drooping eyelids, which we've talked about, trouble swallowing, speech issues, urinary incontinence, and breathing difficulties. These symptoms can
Is it worth it? It worth all of that? It worth all of them someday?
happen hours to weeks after injection, and swallowing or breathing difficulties can be, as you can imagine, life-threatening. That does not mean that every Botox patient should panic. Please don't think I'm fear-mongering people. I'm just telling you
panic, fearmonger. Because we want to put the needle on the cough.
to maybe think and do some research. Millions of people get neuromodulators, but calf injections may involve much larger muscle groups than typical facial Botox area. A calf literally helps you cross a parking lot. The dose matters, the depth matters, the anatomy matters, the injector skills matters, the patient's health matters, and the product being legitimate matters. The label also warns that serious adverse reactions have been reported with unapproved uses of Botox, and that safety and effectiveness for unapproved uses have not been established. That is the part TikTok usually skips because off-labeling neuromodulator use in large locomotor muscles does not fit neatly over a trending TikTok video. It does not exactly have the same ring as Barbie legs.
I got Botox in my calves. I'm a petite girl, but I've never loved my calves. They're quite large for my body, and I can't buy certain boots because I can't zip them up. So I got 50 units of Dysport injected onto
No, her
each calf.
calves not really that big, bro. Like, she have good calves, but what? You never need all of that. You never need all of that at all. What? Like, what? Yeah, me something. Bro. That's how about she petite. She probably just need to lose a couple more pounds. Oh my god.
But I've never loved my calves. They're quite large for my body, and I can't buy certain boots because I can't zip them up. So I got 50 units of Dysport injected onto each calf, which is a lot of Dysport, but these are big muscles. I wasn't really sure what to expect, but I figured it couldn't hurt to try. So we sort of mapped out which portions I don't like, and this is for
Oh, why it
injecting.
look
And
like
it was a
that?
1 week
Oh, shit.
update with like literally no changes. Week 3 is when I start to see a difference and feel a difference too. I've never experienced this sensation with Botox in my face, but when it's in your legs, you'll start to feel something around week 3 where it feels like the
Of course you have Botox in her face too. You see, that's where it started, them kitchen. Oh, I could just come put look in your forehead and this and that and that and that and that. And them can then put Botox in your shoulder, put Botox in your neck, in your jawline, and you reach down your knee. Like, come on, man.
muscles are like pinching and pulling a little bit. One of the most common questions I would get is if I can walk, and yes, you can walk just fine. I think it takes a few months to actually see a difference and for it to become noticeable. But I'm
A
at
few
week 5
months?
and I feel like
when you do something where it take a few months, something like this, and it take a few months. By the time you need it again, by the time you actually want it, all right, I'm talk properly. So say you want some good news for summer, you have to do this in our December, January. All right, that's more than a few months. Probably you have to do it from like February, March, so you can see the results good in a July. That makes sense?
there's a difference. Like, look at this calf and how wide it is compared to this calf and how
It's not that deep.
not wide it is. And with Botox, I
not
think
that
it always
deep.
takes serial treatments to get a real slimming effect. And this feels very extreme, but I purposefully don't wear outfits that show my legs. And I really want to wear cute over-the-knee boots this winter. Is that too much to ask? Anyways, drop your
It's not
questions
that
down
deep.
below on Calf Talks.
Now, the big question that I always like to answer, research and answer that is it long term or do you need it all the time? Calf talk is not permanent. I know there's probably somebody out there screaming right now. It's Botox, y'all. It works by temporarily blocking nerve signals to the muscle. Over time, the nerve muscle communication returns and the muscle starts functioning more normally again, and the calf can regain volume. So it is not a one and done procedure. It is maintenance. You get the result, it fades, and then the question is, do you repeat it? And if you repeat it for years, what happens to the strength? What happens to the gait?
What
the
happened to the
balance,
muscle?
compensation patterns, and what happens to your circulation? What happens to your heart? That is the part I think people should be asking more often, because long-term aesthetic maintenance culture is not always studied as deeply as it is marketed.
I'm ready for my calf Botox.
So first, she's gonna mark the areas where she's gonna inject the Botox. Any last words? Good luck to me. So this is the Botox, you guys.
I might get tired of the video, damn dog. Like, oh my god, why me I get so worried about all this?
It's super quick and super easy. I know some people prefer really toned and muscular calves, but
I do not.
yeah, some people prefer like a slimmer leg effect, so that's why we're injecting Botox into the calves. Purely personal preference. We're not forcing anybody to do this. And the vibrator is gonna help distract the pain.
Thank God, doctor, I do a procedure and the doctor take out a vibrator and say, no. Actually, it's gonna help reduce the pain. It's crazy.
Fine.
Yes, you're all done now.
Thank you. Thank you, MP Anna.
Princess treatment. Calf Botox comes with free shoe cleaning. How long is it gonna take for the Botox to kick in?
I would give it about a good like 3 months.
Okay, well, we'll check back in like 3 months.
The biggest problem that I have with calf talk or Barbie legs is it's not just about the calves. It is what the trend represents. Aesthetics has reached a point where almost every single flippin' body part is being rebranded as a flaw waiting for a treatment. That is what I've noticed, and it does not make me happy. If your jaw's too wide, slim it. If your traps are too visible, shrink them. If your calves look strong, paralyze them. If your cheeks look full, like mine, remove the fat. If your nose has character, file that crap down. If your lips are natural, well, guess what? Inflate them. If your face moves, how about we freeze it? If your body functions, ask whether it could function a little less actively. Don't have people see your full emotions. It is not good.
Crazy.
And the more saturated the beauty industry gets, I'm realizing the more it needs new insecurities. People are spending way too much time.
How the hell only reach a calf? Only reach a calf, dog. Like, only really reach this up. Like, only reach a calf. Only reach a calf. Like, really. Me not understand only reach a calf. But
on their phones, and they need to go outside and touch beach sand. That's the new one. Don't touch grass, touch beach sand. Forehead lines are old news. Lips are old news. Jawline is old news, y'all. The market has to look lower, literally, and ask, well, what else can we convince people is a problem? And that's what I hate the most. And the scary shift I've noticed is that the medical side gets pushed into the background. The most important part, especially in some
just looks, dog, just looks.
No hate, no shade, but I can't. The language becomes softer. You'll hear words such as slimming, contouring, Barbie legs, non-invasive, quick treatment, no downtime. It sounds amazing, but it is soft. And guess what? The mechanism is not soft. I know there's probably somebody like, mechanism? That's my accent. Mechanism. See, I know there's somebody already picking on me. The
Accent
mechanism
from where? Which one should come from?
is weakening muscle tissue on purpose. Now, don't get me wrong, we all have free will. Adults can make their own cosmetic choices, okay? This is just where I stand when it comes to cosmetic surgeries or procedures or non-surgical procedures. What's important to me is that informed choice requires the full picture. Not just the pretty before and after. Not just the influencer standing on her toes pretending she discovered new legs. The full picture includes strength, circulation, gait, balance, vascular history, repeat treatments, and the mental toll of constantly finding new body parts to correct.
For the calves, try this quick test. Stand on your toes and check out your calf muscles. If they bulge prominently, Botox could be beneficial. But if there's more...
Dog, this is crazy. They want to say, stand up on your toe, if you cough, them do what them supposed to do. Get some Botox and get rid of that. Okay.
Fat, then liposuction might be the better option to achieve the desired contour. At our clinic, while we see the benefits of Botox,
this video get me upset.
Xeomin, and Jeuveau as neuromodulators, we've had particularly...
No, not see on my face, maybe, because, you know, too cool. But inside, yeah, it's a problem.
Good results will Dysport for larger muscle groups. Its ability to spread a bit more post-injection makes it ideal for achieving an even and natural reduction in muscle size.
Calf Talks is not automatically evil. Putting that out there before anyone assumes. For the right person, with the right anatomy, evaluated by the right medical professional, using legitimate products with realistic expectations, it may create a subtle cosmetic improvement. But when it becomes a viral trend, that nuance immediately disappears. Suddenly, normal calves become bulky, athletic legs become masculine, and genetic shape becomes fixable. Just stop. Please, just stop. A muscle that helps you stand, walk, balance, and pump blood gets treated like it's just taking up too much visual space. That is the real issue I have with Barbie legs. Barbie does not need calf strength. Barbie does not need a Venus return. Barbie does not need to walk across a parking lot in the hot summer heat carrying groceries, maybe a Stanley cup, a Labubu, a purse. Real people do. Keep that in mind. I'll see you guys next time.
Okay, yeah. That was a video. Great video. People just like, why not do all these things, dog? Like, need to do all these things. But what only thing? When you get the cough, ding ding ding, some of them, you know. I don't know why this have that this specific one just have pissed me off. But yeah. Thanks for watching and bye bye.